I was saying that I should provide some short information about my role because, as you can observe, I'm not a doctor. I'm an IT professional for over 15 years, and nowadays I'm working as the European Digital Hub from northeast side of Romania. Part of our expertise is to deliver technology support and innovation support for hospitals, clinics, and IT-related companies from health sector. And part of this job, I'm combined also with my technology experience. We are delivering also services to help three main hospitals from our region to develop their IT strategy. So it's an interesting ecosystem. It's also helpful to, and very important for me, to be able to see the health system outside from the experience of being a patient and understand also the fight, the happiness, but also the challenges that medical personnel, but also non-medical personnel from these hospitals have to face every day to deliver good quality services for their patient. And part of what my previous speaker presented, I saw very well also in Romanian health system. So everybody right now is trying as much as possible to digitalize, to bring the best technologies to provide very good quality services in the medical system. But on the other hand, something that in Romania right now is still not achieved is to be able to get rid of papers. So unfortunately, we are right now still in a process of working in a combined way. So we have medical applications, but on the other hand, the doctors and nurses are still or still have to do a lot of paperwork, which is actually creating a double work right now. And so this is also a mentality change that we need to do to be able to trust that the applications are doing everything as they should, so we don't have to write on paper anymore. Unless, of course, as my previous speaker mentioned, there are areas where maybe the doctors want to do this. But it's a big difference between being a personal way of doing things and be something that is mandatory. And something else that we noticed, and I think it's very important also to go further, because yes, technology is moving amazingly fast. So we from 2020, from pandemic until now, everybody started to talk about artificial intelligence. Everybody wants the best applications in different medical areas. But we cannot do this as standalone. So even if you create the best hospital, the best private clinic that has the best technologies, if these technologies are not interconnected, right now we still have the situation when a patient is moving from one hospital to another, but he needs or she needs to bring all his medical papers and as a proof, because we don't have a centralized system. So if a doctor from Iași, for example, is prescribing me some medicines and I'm going to Bucharest, I need to bring everything with me, which is sometimes is really creating chaos, and especially in the situation when we have patients that are in danger. So when we need to move very, very fast, don't have time to lose on moving some papers or try to understand what was the diagnosis from hospital A to hospital B. And also something that we see quite often and is an important feedback coming also from the doctors, nurses, and non-medical personnel from the institutions is about the security of the data. So we recently had in Romania few cyber attacks related to big hospitals, and this raised again the question mark about how important cybersecurity is, and also how much can we trust us, meaning not only the medical people, but also me as a patient. How much can I trust in the IT systems, and and also how much can I trust? Okay, maybe the clinic where I'm normally going, it's fine. There were no cyber attacks, but are my data still fine if I'm moving to a different hospital? And this is something that right now is quite important, not only in Romania, but also at European level. And also all the standards, so GDPR, and not only, there are also some other international standards about security, and also the new legislation that is in place at European level, like NIS 2. So are signs that what we try to do is to secure as much as possible all the data. So not only about patient, but also the employees' data and everybody and not only from the medical system, but medical system is really sensitive from this perspective. So we need to pay a lot of attention to this. Thank you.